You may be filled with fear and anxiety if you or your loved ones needed to undergo brain surgery. But modern technologies have significantly changed the outcome of brain surgeries. With advancements in technology, brain surgeries are now safer. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So let's discuss and know more about the recent advancements in brain surgery. So joining our discussion today is Dr. B.J. Rajesh, Consultant Neurosurgeon, and Dr. Vishwanath, Consultant Neuro-anesthetist from Yashoda Hospitals, Secunderabad. Welcome to the program, doctors.
Thank you.
Thank you.
So doctor, traditionally the field of neurosurgery is always associated with fear and it's supposed to be very complex. But the modern technologies have conventionally changed the way we practice neurosurgery. So how do you think that this field has evolved and how do we approach different conditions?
See, I've been practicing neurosurgery for the last 24 years. So I've seen the entire evolution of how neurosurgery has changed over this past 25 years. So these things are partly determined by the skill with which we are getting trained and learned, and also the way the technology has evolved, and also the medications and the support systems what we have while practicing neurosurgery now. What we are doing is we are rarely keeping a brain tumor patient in an ICU. In fact, the stay is totally come down. Patients are functionally intact. We were earlier calling them as total resections. That was a concept which was there. From there, now we are talking about maximal safe resection. Now, this concept has evolved because of the allied technology what we have, and the entire primary focus is the functional quality of life, at the same time removing maximum tumor.
So talking about modern technologies changing the outcome of brain tumor surgeries, doctor, what exactly do we mean by this?
Yashoda, Secunderabad is one of the first hospitals having intraop MRI, where inside operation theatre we have an MRI, where while doing surgery we can stop in between if we have a doubt of residual tumor, get an MRI done on the table and try to remove the additional tumor, also to assess whether we have caused any damage to the normal tissue or not. So this will definitely avoid a repeat surgery, which psychologically is a bad thing for a patient. Similarly, like what you have a GPS navigation in your car, we have what is called as navigation systems, where the system will guide us as we navigate inside the brain. In addition, we have high-end microscopes, then we have technologies to remove tumor easily, and we also do what is called as intraop monitoring, neuromonitoring. Now this is something very few centers are doing, where many of the patients are awake. We keep talking with the patient, try to understand the functions of the patient's brain while removing tumor. These are few things which has really changed the surgical outcome. The advances in microscopes, the endoscopes, then other surgical equipment has radically changed the neurosurgery.
So with the advancements in surgical skills and better imaging technology and also neuroanesthetics developments, we have made a way for the establishment of what is called as fast-track surgery or daycare surgery in neurosurgery. So what exactly do we mean by this?
So daycare surgery is well established, many subspecialties, but in neurosurgery is recently coming up. It's like the patient is admitted in the morning and then we discharged in the evening. Now we are able to do a fast-track neurosurgery where patients with brain tumor doesn't go to ICU at all. Irrespective of the tumor size or length of the hours, everything depends upon how quickly the patient comes out of anesthesia. And then we observe the patient in observation ward for about 2 to 4 hours. We'll do a CT scan, and if there's no complications and this patient is doing fine, the patients are shifted directly to the ward, and then probably in a day or two, depending upon certain factors, we'll be able to discharge them. Now this is called a fast track, and this primarily apart from surgical skills and the armamentarium, the most important thing is the advances in neuroanesthesia. We are very fortunate that one of the few hospitals in the country which we have a dedicated neuroanesthesia team, where a specialist neuroanesthetist is working with us, and it's because of their skill we are able to do this fast track. We have Dr. Vishwanath with us, who is a neuro-anesthetist. He will briefly talk about how fast-track anesthesia for brain tumor is done.
We in field of anesthesia or neuroanesthesia, we have advanced way of monitoring the patient, and there is ultra short acting drugs are coming in the field. Many times there is a myth, like when you do a brain tumor surgeries, we have to keep the patient on ventilator for overnight in the ICU, or when you extubate the patient in a brain tumor, we have to send the patient for observation for in the ICU for monitoring. So that are the things we are avoiding. At the same time, before going for this fast tracking surgeries, the selection of the patient is very much important. We select those patients for fast tracking. The patient does not have any comorbidities, like patient does not have any cardiac issues and uncontrolled blood sugars. If those things are not there and patient is fitting into our criteria, then only we will counsel the patient. So we'll patient and patient attenders about what the plan we are doing, then we'll proceed for the our fast tracking for the surgeries.
So fast track surgery, as the name rightly correlates to time. So what benefits would a patient be having?
See, the fast track neurosurgery definitely affects the person's psychologically, emotionally, financially. It will be a lot of benefit to the patients. Now functionally, especially in these days where a lot of tumors we are seeing in younger patients and working class group, for them having a brain tumor taking off for many weeks is definitely affects their financial status as well as their quality of work. Now having a fast track surgery, they can quickly go back to their work and they are back to their routine. Scientifically, it's been proved that most of the problems after surgery, brain surgery, do happen in first 6 hours. So if first 6 hours nothing happens, many times no complication happens. That is the statistics what we have, and based on that we realize that we can come down on all these things. And over this last few years, I have seen many of the patients whom we discharge early, they are extremely happy. And many times a simple thing is that we don't remove hair, and that's a common thing. And the third day, fourth day, patient is discharged and is back to his home. And when the relatives comes, both the patient and the relatives are shocked, and they're psychologically so well that patient is totally fine. They feel like no surgery has been done. Now this plays a long way, this goes a long way in their emotional and psychological aspects as well.
So all these fast tracking surgeries, we are asking the patient to come and admit on the day of surgery. Once the surgery is done, so we are shifting the patient. By walking, patient is going to the post-operative ward. In the post-operative ward, we are removing all the lines, all the catheters in the post-operative ward, and we are breaking the NBM, like we are making them to eat or drink within 2 hours of the surgery, so that their bowel and bladder problems will not be there, and by early mobilization will not have any problem related DVT related deep vein thrombosis problems we can be avoided in these cases.
So thank you, Dr. B.J. Rajesh and Dr. Vishwanath. It was wonderful having you here on our program today. So before we wrap this episode, is there any message that you would like to share with our audience out there?
So the message is that the brain surgeries are now safe, simple, easy, unlike what it was there about many years back. ముందట్లాగా మనకి బ్రెయిన్ సర్జరీ అంటే ఒక సీరియస్ కార్యము, పేషెంట్స్ జీవితం అయిపోయింది, బెడ్ రిడన్ అయిపోతాడు, చాలా రోజులు ఇంట్లోనే ఉండాలి, వేరే పనికి రాడు అనేది ఇప్పుడు పోయింది. ఇది ప్రైమరీలీ జబ్బులో ట్రీట్మెంట్ చేసే విధానంలో మార్పు వలన ఈ స్టేజ్కి మనం వచ్చాము. ఇవాళ రేపు బ్రెయిన్ సర్జరీస్ చేసుకొని వారం 10 రోజుల్లోనే మనము మన పనికి వెళ్ళే స్థితికి రాగలిగినాం.
With the advancement of monitoring and with the help of ultra short acting drugs like remifentanil, sugamadex, these kind of drugs, we can safely practice the fast tracking in neurosurgeries, and with the advanced monitoring we can extubate the patient on table, and we can discharge the patient early from the hospital.
So this brings us to the end of this episode. Hope this episode on recent advancements in neurosurgery was both informative and inspiring, and don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.